Hello, and welcome to AAKP's Policy Summit, Patient Voice, Patient Choice, New Determinants for Kidney Policy. I'm Jennifer Raitt, AAKP's Marketing and Communications Manager. I'm pleased to introduce our final session of this year's Policy Summit that will speak to some of AAKP's major advocacy initiatives and capacities. All three of these programs you will hear about are strategically complementary to each other, and by the close of the presentations, you will understand how and why. As champions of research and innovation, AAKP fights for every patient to have care choice and timely access to safe, new innovations in kidney care. As patient consumers in the healthcare market, AAKP recognizes how powerful the independent and organized patient voice can be in helping remove barriers to innovations, including those already approved by the FDA and those that are under development. You will learn more about this as our Executive Director, Diana Clynes, discusses our Patient Voice, Patient Choice initiative. In addition to exercising care choice and elevating an independent patient voice, AAKP understands that patients have another great power, and that is the power of your vote as an American citizen. Voting keeps elected leaders accountable to individuals like you and responsive to your concerns about innovation, regulations, and payment for advances in kidney medicine. That is why AAKP launched the first and largest voter registration program in the kidney space, our KidneyVoter initiative. Through this program, AAKP has reminded elected leaders that kidney issues and kidney health are important to patients every day, and not simply on World Kidney Day or during National Kidney Month. While those dates are important, AAKP encourages kidney patients to keep elected leaders accountable and answerable to your health concerns every day. You can do this by registering to vote and determining which of your elected leaders is truly supporting care innovations. Our Director of Patient Insights, Data Analytics, and Advocacy, Erin Kahle, will walk you through this program. The kidney space has seen little research and innovation over the last 50 years. But there is a massive shift underway. New investors and companies are entering the space, and kidney patients' consumers feel even more empowered and influential than they did just 5 years ago. As we support the innovation community and researchers in their efforts to transcend status quo care, we are expanding our national and global operations during the AAKP-initiated Decade of the Kidney. AAKP's Paul Conway will rejoin us to discuss some of these efforts and give us a preview of some of the exciting activities AAKP has in store to expand patients' involvement in policy and kidney innovation here in the US and internationally. The future is bright, and AAKP is helping become an even bigger part of change through our unique programs. To begin, I'd like to turn it over to Diana Clynes.
Thank you, Jennifer, and thank you to everyone for joining us for this session. My name is Diana Clynes, and I'm the Executive Director for the AAKP. For this presentation, I'd like to provide an overview of AAKP's Patient Voice, Patient Choice initiative. But first, I'd like to provide a brief overview of AAKP and some guiding principles that helped us to developing this program. AAKP serves all individuals with various causes of their kidney disease and across the disease spectrum, from those at risk for kidney disease to those recently diagnosed to individuals needing a kidney replacement therapy like dialysis or transplantation. Founded in 1969 by 6 kidney patients, AAKP has always been a patient-led organization. We educate patients and policymakers on the need for greater investments and innovations in kidney disease research, detection, and treatment. We are also known nationwide and across the globe for our aggressive advocacy on behalf of kidney patient consumers and their right to treatment care choice in consultation with the doctors who they choose to care for them. AAKP defines high-quality kidney care as timely patient access without interference to innovations that help prevent and treat diseases and empower patients to remain healthy, independent, and better able to pursue their aspirations, including meaningful full-time or part-time work and a career, home ownership, starting and supporting a family, and a secure retirement. Based on our strict patient focus, the need to disrupt the current status quo kidney care, and the critical need to ensure all kidney patients have access and choice to all safe FDA-approved treatments, in 2022, AAKP launched the Patient Voice, Patient Choice initiative to focus the power of the patient voice on payers most responsible for determining patient access to new innovations in kidney care. Through this platform, AAKP has mobilized those impacted by kidney disease by engaging them in the ways that are most effective in elevating their voice in the policy and payment decisions that impact care access. It's an interactive platform where patients and care partners can use to quickly identify current issues impacting care choice and treatment. And the platform aims to eliminate the unnecessary interference when artificial barriers or delays threaten patient access. By visiting www.patientvoicepatientchoice.org, you can learn more. This slide demonstrates a quick screenshot of the Patient Voice, Patient Choice platform. As AAKP identifies issues of concern where patient access and choice are impeded, we work to launch a campaign on that particular issue. If you visit the Patient Voice, Patient Choice webpage, you can easily see individual campaigns. And when you click on the campaign box's Show More tab, it will expand out and provide specific information on the access issue, additional resources such as articles or on-demand content. And as AAKP tracks these access issues, there may be opportunities where we need you to take action. This could be in the form of signing a petition, sending a letter to your state representatives, or sending a letter to a federal agency representative to make your voice heard about important issues that may impact your care. So join the fight by lending your voice in support of fellow patients who can benefit from greater access to new innovations. Check out www.patientvoicepatientchoice.org to learn more. And if you aren't a member of AAKP already, membership is free. So join today at aakp.org/join. And you'll receive AAKP action alerts when it's important for you to take action. Thank you, and I'll turn it back over to you, Jennifer.
Thank you, Diana. I'd now like to welcome Erin Kahle to discuss our KidneyVoter initiative. Erin, welcome. The floor is yours.
I'd like to share with you how your vote and your voice can have an impact on 2021 and beyond. With the AAKP Action Center, you can make sure your vote counts and your voice is heard. You can share your personal story as it relates to kidney disease, dialysis, transplant, or as a living kidney donor. You can help to make kidney disease a global priority in the eyes of lawmakers and public servants. And you can contact your elected officials and take the letters we have drafted for you and personalize them with your story, aspirations, and goals as someone impacted by kidney disease. You can access our Action Center from our homepage, aakp.org, by hovering your mouse over the Center for Patient Engagement and Advocacy heading and clicking on Action Center. I have also included a direct link on this slide. From the Action Center, you can register to vote, or you can take action on a specific legislative issue by personalizing a letter to your U.S. senators, U.S. representative, and other elected leaders. In 2018, AAKP created the first ever Kidney Community Voter Registration Drive. We have increased our impact over the years, and since our launch and labeling of kidney voters, our impact has accelerated. Elected leaders are now interacting with both a patient community and an informed, well-organized voting constituency in every state. This has not been done before in the kidney community, but has had great success in other patient communities like HIV and breast cancer. We encourage you to follow us on social media and participate in the kidney voter campaigns we hold year-round and on important days like Election Day. It is easier than ever to become a kidney voter. You can register right in our Action Center. Enter your mailing address and you will be directed to information about voting in your state. It is very important to remind your elected leaders in both parties that you are a voter who is managing kidney disease, or that you're a family member or have a loved one of someone who is managing kidney disease. This adds a new element and a reminder of your importance to the discussion. AAKP is nonpartisan, meaning we never tell patients, caregivers, or medical professionals how to vote. But we do encourage everyone to register to vote. Research each candidate and ask elected leaders about their positions on issues like innovation, new biologics, devices, and diagnostics. Make sure they understand the challenges of living with kidney disease and what you would like to see changed. We hope you will be part of AAKP's Action Center if you are not already. Your voice will be heard, and we will change the status quo and make improvements in care and treatment of kidney patients. Please check out the September 2019 issue of our Renal Life magazine to learn more about becoming a kidney voter. And you can also read a blog post on our website from a member of the AAKP Board of Directors and Ambassador, Dale Rogers, on why he is a kidney voter. Become a kidney voter and use your voice to inform how kidney patients are cared for.
Thank you, Erin. And now I'd like to welcome back AAKP's Chair of Policy and Global Affairs to share highlights of the Decade of the Kidney.
Thank you very much, Jennifer, and thanks for putting together the top 5 questions that we often get about Decade of the Kidney. So we'll go ahead and fly through these, and I think it will be informative for folks to understand exactly what we're doing with the initiative of Decade of the Kidney. Let's go ahead and do number 1. The Decade of the Kidney originated in late 2018, early 2019 in our internal discussions at AAKP. Ed Hickey, who's an expert in legislative initiatives in the Congress and has worked in the executive branch in 2 presidential administrations, was key to this because Ed had worked on Decade of the Brain in the late 1980s and early 1990s for his congressman, Silvio Conte. And in that initiative, they put together the Decade of the Brain in order to get people to focus on the research investments and the long-term requirements that were needed to move forward medical research in the area of the brain. Similarly, we talked amongst ourselves about the fact that there did not seem to be an overarching policy framework and communications framework for many of the things that were happening in the kidney space. And we talked even more about this in detail about Decade of the Kidney as we were working with the administration, Secretary Azar at the time, on Executive Order Advancing American Kidney Health. And so what we wanted to make certain was that there was a framework that we could announce as major patient stakeholders in the process so that when an executive order was issued, there was life in a constituency that existed beyond a presidential administration, and that it was very clear there was a focus point for researchers, for industry, and for patients, not just in terms of policy, but in terms of communications. And that's why we move forward with labeling the decade of 2020 to 2030, the Decade of the Kidney, and we trademarked it so that we can share this initiative and invite other people to join with us in it and keep the messaging on it consistent and patient-centered. Well, Decade of the Kidney really serves as a broad framework under which everyone in the kidney community and new companies and new researchers who have not been in this space before can come under and be united in a long-term goal that's immediately recognizable to anyone who's involved. AAKP stands for innovation. We will work with any partner anytime to advance kidney research, advancements in industry through therapeutics and diagnostics and drugs, and policy. And so under the broad framework of Decade of the Kidney, anyone can join and participate in it, but it sets a public expectation that within 10 years, we will see real progress in the transformation of status quo high mortality kidney care in the United States and around the world. So at AAKP, what we do with Decade of the Kidney is we use it both for our external relationships as well as our internal operations. So for our external relationships, when we're talking to companies about sponsorships, when we're talking to researchers about our polling data or our survey data, or when we're talking to government officials about appropriations and legislation, we ask them to reference the Decade of the Kidney, and we'll explain to them why. Because patients have an expectation that change can happen, and it can happen within the decade, within their lifetimes. Most of the folks that we talk to about that are very understanding, they love it, and they get the idea of it. Internally, what we do is we make certain that everything that we're calculating and trying to weigh out for decisions and operations of how the organization works has some tie to Decade of the Kidney, meaning if we're going to do communications, stakeholder relationships, policy development. How will this answer the question of how can we better impact progress in kidney disease research and outcomes in the next 10 years? So it gives us a great framework, and it gives our external partners a great framework. Well, in 2022, one of the key developments that we had, and we were very excited about it for Decade of the Kidney, was its adoption as the formal theme for a major event before the European Parliament. And I scratched out on a list here some of the organizations that have adopted this and been a part of it in Europe just in the past 8 months. So in front of the European Parliament earlier this year, they had the European Kidney Health Forum. And as participants in that, you had our great friend, Dr. Ray Van Holder from the European Kidney Health Alliance was part of this, the European Renal Alliance, the European Kidney Patient Federation. And they came together and they used Decade of the Kidney as the theme for their major event in front of the Parliament that discussed better kidney outcomes, the development of artificial organs, and some of the policies and investments that will be made in the EU that are very similar to the ones that we advocate for. So we were very excited to share the theme with them and to see how they were able to take it and run in many different countries in Europe. And that's exciting for us. One of the other key developments in 2022 was its adoption and embrace by the International Society of Nephrology and a number of companies also that are coming into the renal space. So we're excited about what happened in 2022 and looking forward to 2023. For 2023 and 2024, we expect continued growth in the Decade of the Kidney initiative, both internationally and here in the US. Internationally, it's embraced in Europe and through the International Society of Nephrology and other organizations that we're actively in discussions with now, mean that you'll see a series of partnerships that are coming out in 2023 and 2024 that reference and embrace the Decade of the Kidney, much as what was done in Europe in 2022. Internally, here in the United States, we expect much more happening in the realm of policy and appropriations for kidney research and innovation, and the companies and the elected officials and others that are involved in some of those key decisions talking about the Decade of the Kidney and embracing it. And again, this goes directly to the issue of meeting the patient expectation that change should happen and that status quo high mortality kidney care in the United States needs to change and evolve to be where patients are, which is our expectation is there should be change, we should live longer, and we should have access to the best technologies. But much of the course of the Decade of the Kidney will be determined by AAKP's new leadership team. So we have 2 U.S. Marine veterans, Ed Hickey and Jennifer Jones, at the helm of AAKP, and a very active board. There's virtually no limit to what we'll be able to achieve with Decade of the Kidney and with so many different partners that are interested in it, especially private sector partners.